So, social distancing, mass gatherings. You know, the county fair has been postponed. Our powwow has been postponed for the third time now, I guess. Third time. How do you feel about the prudence of mass gatherings in our local area?
Yeah, given our true local, and I'm talking about Robeson County, our local prevalence is still quite high. It would be advised to limit social gatherings, right? So I'm telling people, whatever you did back in December, January, when we had high numbers, it's the same. So the same rules apply. When numbers are very high, you should really limit gathering indoors in a crowded place. You should limit as many unmasked exposures as possible. So you need to take extra caution, because you're way more likely to have one person in that place that has COVID now than what you did 3, 4, 5 months ago when the prevalence was lower. And especially if that one person doesn't wear a mask. So we've proven that in a indoor place, if one person doesn't wear their mask and they happen to have COVID, whether they know it or not, they can infect many people even if they have their mask on. I mean, that's been proven in classroom settings, for instance. So a teacher can remove their mask for minutes to read a book, minutes. Their doors can be open, the windows can be open, we can feel like we're safe because it's ventilated, and one teacher can infect dozens of kids in a classroom that were wearing their mask. So why take that extra chance, the unnecessary chance?
So what can parents do that have children in daycare or I call it kindergarten or the public schools to keep them safe? Once they get to that environment, there's nothing a parent can do but have faith. But what can parents do to protect their children, their youth, from preschool on up to 12th grade?
Yeah, it's very tricky for our kids who are yet to be vaccinated, right? So right now it's 12 and older. So our young kids in daycares and our young kids at elementary schools don't have any vaccine to protect them. So we're going by the essential original rules we talked about last year. So teaching our kids to wear a mask appropriately over their nose and mask is the number one rule, okay? Of course, it will be helpful for the community strategy if those adults who are eligible to be vaccinated can become vaccinated.
To protect their children.
So when you have teachers and daycare workers that are vaccinated, it's not only protecting themselves from the little ones, they're helping protect and limit transmission and spread amongst the classroom or daycare setting. But it's very hard in small kids who, I know under 2-year-olds, you can't expect them to wear a mask. Even a 2 and 3-year-old, it just depends on that kid, their personality, but it's really hard to get them to wear a mask all day, you know. Once they're 4, for sure 5, we expect a kid to wear a mask. But those smaller kids, it's very difficult. You should limit as many unmasked exposures as possible. They should not be gathering outside of a small group of people, so limiting all total exposures, encouraging daycare workers and teachers to vaccinate. And following simple rules like as soon as you notice a symptom in that kid, it could be a runny nose. As soon as you notice a symptom, immediately isolate that kid and test them. Don't continue to send them to school or daycare when they have a symptom and you don't know if they have COVID. Because now you're not only, not treating that patient, but you're letting that one kid potentially spread to many other kids, and at the minimum inconvenience many families, but of course at the most spread that COVID to another household that may have a bad event. So making sure parents know, kids of all ages, but especially those who aren't vaccinated, if any symptom you need to isolate them and get them a test right away.
Well, Dr. Chamaine, I want to thank you again for your commitment as a frontline medical professional representing your Lumbee people and all people in this local area and all the good work you're doing and helping people who have other medical problems besides just a COVID shot. But you got to have that COVID shot. People that take heart medicine, blood pressure medicine, cholesterol medicine, all these diabetes medicine, to me this is just part of that cycle of life where you just protect yourself. You're protecting yourself anyway with those things. Protect yourself from the COVID, right?
So let me add one thing. As a primary care physician managing many chronic medicines and focus on preventive care, I'm trying to help people live a long, healthy life, right? So if you have diabetes, well, I want to control that diabetes and prevent a heart attack, okay? Well, if you've had a heart attack or stroke, I want to prevent a second heart attack or stroke. I want to try to keep you living long, right? And part of that means preventing admissions. Well, what this vaccine does is not only does it reduce COVID, it dramatically reduces the chance you have an adverse effect. You'll be severe enough to go to a hospital or die of COVID. All hospital statistics around in our country prove that more than 90% of all admissions for COVID, no matter which area, which region you look at, they're all taken up by unvaccinated patients. Meaning, getting your vaccine dramatically reduces your chance that you will get sick enough to go to a hospital. Most people who are dying of COVID are unvaccinated. And we feel the burden because we know that the science is there, the facts are there to show vaccines literally save lives. This isn't just a mantra. This isn't just a random textbook, what doctors say. We know the facts, we see it. Every patient I have lost to COVID, it was unvaccinated. I'm saying personally for me, okay? Everybody I know that I personally know in the past several weeks that has died from COVID, not a patient, but personally, was unvaccinated. That likely could have been prevented, okay? And so we're straining our healthcare. Our hospitals are filled to the max. They're always on diversion. We don't have enough rooms, we don't have enough beds. We're short-staffed, we're overworked. We're feeling this burden and it's affecting everybody, COVID or not. You can go to the emergency department for a legitimate reason and they're too busy to see you and it can take hours to be seen. And we're not giving the best care and the quality, the time that we really want, that you deserve because we're so busy with COVID, right? And getting your vaccine can protect you, can protect your community, can prevent people from suffering in a hospital. I'm trying to encourage people to not get sick enough to go to a hospital or let alone die from COVID. I mean, that's why I'm here,
Right.
you know?